Our first guest today is Annabel Reid. Annabel is an insightful and strategic leader with over a decade of not-for-profit experience in executive in the healthcare sector. Her expertise spans people, leadership, commercial transformation, advocacy, operational excellence, change management, and embracing a culture of learning and growth. Annabel is known for her ability to create purpose-led, member and stakeholder-focused teams with a cultural vision of clarity, collaboration, and the courage to move at speed. Annabel has living experience as a carer and understands the challenges associated with juggling work, family, and caring responsibilities.
Okay, I'm going to talk to you today a little bit more about carers, unpaid carers, noting there are some unpaid carers in the room, which is fantastic, the virtual room, I should say. And then we'll talk a little bit more around the insights that we've found as an organisation around what our culturally and linguistically diverse carers need from us to be successful and well cared for in their caring roles. So first up, let's speak a little bit about Carers Australia. So we're the peak body representing Australia's 3 million carers. And when we talk about carers, we're talking about a friend or family member who provides support to another person because they live with disability, a chronic health condition, mental illness or a disorder, including substance abuse, terminal illness, and they're frail and aged. So we're not talking about paid support workers within the definition of carers that we use at Carers Australia. And we're not talking specifically only about family, because family are not always carers and carers are not always family, especially when we think about people with chosen family. So Carers Australia is the advocacy body, and we try to raise up the voices of carers and listen to their insights and share those with government so that policy and services can be influenced at a national level. And we do that together with our National Carer Network. So there's a carers organisation in every state and territory in Australia doing the same thing, representing carers at the local government, at state and territory government level, and also at a community level too. And many of our network members provide services for carers like respite, peer support, counselling and so on. So why don't we talk a little bit more about carers before we deep dive into our culturally and linguistically diverse carers. So here are just a few statistics, but when we talk about 3 million Australians, it's almost 12% of the total population of Australia, which usually surprises most people. And I don't think that includes everyone who is a carer, because many people don't identify with the term carer. They think I'm, a parent, or I'm just a daughter or a husband caring for often a loved one. Noting that not all carers are caring out of love. Some do care out of a sense of responsibility or duty, or due to lack of options. About a third of all carers are primary carers, which means they have the primary responsibility for carer. And out of those primary carers, about 2/3 are women. Out of all carers, it's almost half and half, to be honest, because we're looking at a lot of, friends and family members that pull together to look after someone. We do know also that many primary carers, about a third of all primary carers, are spending more than 40 hours a week of care. So that's almost like a full-time job. And we know that, just under 13% of carers are under the age of 25. And at Carers Australia, we speak to young carers a lot, and we often hear from young carers that tell us they started their caring journey before they can remember. So we're talking about children at primary school, often navigating care on behalf of a grandparent where a parent has mental illness, for example. So often a young carer can be doing the parenting, and we often forget about our younger carers caring. I think our minds often naturally go to, a middle-aged adult person caring, but that's not always the case. Carers also face some challenges, and this is certainly true of culturally, linguistically diverse carers too, but overall, if we think about the total carer population, we run a national survey that gets over 9,000 responses every year called the Carer Wellbeing Survey. And our findings are that carers have substantially lowered wellbeing compared to other Australians. This can be due to a variety of factors, but it does include loneliness and isolation, particularly where they're caring for someone where there may be stigma around the condition, for example, caring for someone who's mentally unwell or who has dementia with difficult behaviours. That can be very isolating. People don't understand what you're going through. And this can lead to feelings of loneliness and lowered mental health outcomes for carers themselves. We also know that carers are sadly 3 times as likely as other Australians to be poor or very poor. So there's a significant financial impact. And we just looked at that slide that talked about carers often caring for 40 hours or more a week. As you can see, that makes participating in paid employment quite hard. So carers can often reduce the number of hours they work, choose different jobs, jobs that better support the flexibility they need for care, or they may drop out of work entirely. And of course, this affects the amount of money their family or their household has, including the superannuation they retire with. Carers retire with far less superannuation and lifetime earnings compared to other Australians. And lastly, we know that carers struggle with system navigation, not because they don't know how to do it, because it's really so hard. And it means that because they're time poor, they're trying to work and care and probably parent and do other things in their life at the same time, contribute to the community. They're juggling a very high cognitive and emotional load, and it makes system navigation and dealing with the endless administration that goes with caring really exhausting and stressful, especially when you're navigating supports and you're worried you're not doing the right thing by the person you care for. Carers are often racked with guilt and wondering whether they're doing the right thing. So that's a bit of a scene setter for carers. It's not all bad, but there are certainly some challenges that carers face through their caring role. So let's take a little look further at culturally and linguistically diverse carers. And the first thing I want to talk about that affects carers is respite. Respite is hugely important. We spoke before, just a moment ago, about carers having lowered wellbeing and lowered mental health outcomes. Well, ways that can be sort of supported for carers, some of the things we can do to support carers is provision of respite that's fit for purpose that they can actually access, which means the person they care for can be looked after and give the carer a break. That can come in many different formats, but we do know that it's underutilised sometimes when respite is available, and that's because, I know through the Carer Gateway, sometimes there are jurisdictional divisions of care. So here in Canberra, where I'm from, some carers who live in Queanbeyan, which is about a 25-minute drive away from the centre of Canberra, because they're in New South Wales, their nearest respite centre might be Sydney. So to drop the person they care off, say you've got a medical appointment or a small procedure that takes half a day and you need someone else to look after the person you care for, they'd have to drive to Sydney and then come back to Canberra and get the procedure and then try and get to Sydney to get the person. So sometimes respite can be inaccessible and impractical. Now, this is even exacerbated for culturally and linguistically diverse carers where the respite might not be fit for purpose. So we know that I'll start calling them called carers just to keep it simple. We know that sometimes there can be cultural barriers to effective care. So, for example, we spoke to a carer. She was caring for her father, who was aged and needed sort of physical support around the house. And he came from a culture where people speak really robustly and use their hands. And the people she was paying to help come and support him took that as aggression and were refusing to support him because they misunderstood the way he was communicating. So we know that's where we start to talk about fit for purpose respite. There was respite available, but it wasn't working because there was a cultural barrier to the understanding of the person being cared for. We also know that, language, I'm sure you're aware of this, language can be a barrier. And we also know that, it's even more difficult. It's difficult finding respite full stop. There just isn't enough around and it's often not available but getting it culturally fit for purpose is extremely challenging. And you can see the results there where called carers find it even harder to find appropriate respite than other carers in an already difficult situation. And that, of course, will go on to affect their health and wellbeing negatively. Stigma and isolation was flagged by called carers. We've done quite a bit of research, including a dedicated called carer roundtable that we undertook last year, and that's how we've elicited these insights in addition to the carer wellbeing survey. And as you can see, the quote there is, carers we feel underground and not seen. And in some cultures, there are certain conditions that aren't really readily accepted. That could be a mental health condition or conditions with particularly difficult behaviours. Sometimes autism spectrum disorder can present with difficult behaviours, for example. And so culturally, if a problem isn't perceived, then the role of the carer becomes utterly invisible because people around them don't accept the work they're doing to mentally support another person because they don't accept the condition itself. And it means that carers can become very isolated. Isolation can also happen through presumed roles. So in some cultures, I'm just going to read from the report we did that was dedicated to called carers, but a carer identified that in her culture there's an expectation that you don't need external support or a holiday. And I think by holiday she's talking about respite here because, quote, my wife is at home, so why do we need support? The care is an assumed role for her, so it's assumed she doesn't need any support with the role she has, which means, when we're talking about that 40 hours plus, and for some people needing maybe 100 hours of care a week, there's no one helping there because it's presumed that's a role she will do and that she's fine with it. We also know there's a lack of recognition from health professionals, particularly for called carers. And you can see the quote there about going in for a diagnosis with a husband and not being given any information on how to manage that condition. So just to exacerbate the world that carers sort of fall into through what is really a constrained choice, there's not a lot of support from the medical and health community or recognition for their role at all as an expert on the person they care for, but also almost acting as an unpaid workforce where they might need some training and support. So when we add language barriers on top of this communication, called carers tell us that they're often walking away from a diagnosis or an interaction with health professionals, feeling utterly in the dark about what's happened and how they can support the person they care for moving forward. And lastly, I'll flag high psychological distress. So we use, the Kessler scale in our carer wellbeing survey to measure mental health outcomes. So we know that there's a differential when people have English as a second language and they're First Nations. They're going to have higher levels of psychological distress experienced as carers compared to other carers, noting that carers have higher psychological distress and lowered wellbeing compared to the population. So we know we're talking about particularly vulnerable cohorts. I also just want to briefly mention the term carer. We have a Carer Recognition Act in Australia that's federal legislation that talks about carers' rights, and that's why we use the term carer. But of course, some people resent that term. I'm particularly thinking that someone has a mental illness, they might resent the fact that they need a carer, for example. And so a lot of people, but particularly called carers, don't identify with that term. They think about their family relationship or their friendship relationship with the person they care for, and that's the primary essence of their relationship. They're not identifying what they do as caring. And without that identification, that self-identification, it is harder to connect carers with supports because they're not thinking of themselves in those terms. So something we can certainly do to support carers is start to talk about the act of caring so they can identify with the things they're doing in the day and then use that to help connect them with supports. And I'll quickly touch on a few supports. just to close out. But of course, I mentioned before there's the National Carer Network. So carer organisation in every state and territory in Australia that is dedicated to supporting carers. And we all work together as a network and refer to each other and work on, policy influence and those sort of things together. So there's a huge network there that is set up for the sole purpose of supporting carers in Australia. There are also Carer Gateway Services. That's a federally funded program of carer services. And there are different providers in every state and territory. And I think in New South Wales, there are 4 different area providers. The carers can go there and get things like counselling, peer support, respite, training and education, and things like that can help them in their caring role, but also to manage their caring role and be healthy and safe and well. I've listed a few other supports there, but I do know we work with lots of federal departments to enable their support for carers too. So we've recently been speaking to the Department of Veteran Affairs, for example, to see how they can better support carers of veterans on their website. We speak with Open Arms, Dementia Australia, Palliative Care Australia, Services Australia. We talk to them because they interface with a lot of carers who receive the carer payment, the carer supplement and allowance. So Carers Australia is constantly working with organisations to try and make that navigation just a little bit easier and to improve the recognition we have for carers, making sure they're identified and supported. And the National Carer Strategy that was delivered last year has a specific focus on how Carer Gateway and other federal government services can be better shaped for called carers, First Nations carers and more. So I just want to reassure you there's certainly a lot of attention going into how those supports can be better shaped and tailored to give the best possible experience to culturally and linguistically diverse carers. I'll quickly point you to a report that we have on our website, so really happy to share this with the team if you want to do a deep dive and understand some deeper and richer insights around what we know called carers need to really thrive. And that's all from me. I'll leave it there. So thank you so much for listening and making the time.
Our second guest today is Viviana Jimenez. Viviana is a dedicated healthcare professional with a bachelor's degree in medicine from Columbia and a master's degree in public health from Queensland University of Technology. Viviana's journey brought her to Brisbane in 2011 as an international student. During this time, she faced the challenges and barriers that many migrants experience, which deeply influenced her passion for social justice and health promotion. For over 6 years, Viviana has been a vital part of the World Wellness Group, dedicating 5 of those years to the Multicultural Connect line. She started as a worker, quickly advancing to team leader, and now proudly serves as the manager of both the Multicultural Connect line and the Culture Care program. Her personal experiences and commitment to making a positive impact drive her work as she strives to support and uplift diverse communities. Welcome, Viviana.
I will be talking to you about the Culture Care program. It is one of the programs within World Wellness Group. My presentation will be about a little bit of statistics, some gaps identified while putting together the program, and then it will be a lot of what's Culture Care, what we do, eligibility, and referral pathways. So I'm touching of some statistics that Annabel already touched on. This is information that comes from the Australia Bureau of Statistics and is for people identified as carers. However, multicultural carers in mental health are very well underrepresented in any formal data capturing system. So this is just a very little snapshot of what we can see, but it's always an iceberg and there is more under the water. So why is this important? What this data was important for me to show? Carers in mental health from multicultural backgrounds are often face barriers that are quite unique and challenges. They are related to culture or acculturation, and there's very well structural barriers for them. So starting with culture, child carers do not identify themselves as carers. Annabel already gave a little bit of information about this, and is very well about the cultural role expectations. And they identify as siblings or moms, dads, aunties, uncles. So their belief is that if they're named carers, there's a detachment definition or in that term, or there is a burden of that comes with that support. So sometimes they don't use it, or is expected, as Annabel said. As an elder brother, elder sister, you are expected to care of your aging parents or grandmother. Mental health itself is a term that is not understood. In some cultures, mental health there's not a direct interpretation of it. Is about what does it mean, what does it sound, how does it feel. So a lot of people might not identify that they have mental health needs, and they need help. There's high levels of stigma and shame around poor mental health. And multicultural carers in mental health hold a higher level of emotional and psychological stress, financial stress, and isolation and poor quality of life. And that is because besides what we've been talking about of the mental health identification, being called carers, the clients that we usually work are refugees or asylum seekers, and they have been through trauma in their home countries and in their migration journey. But also unforced migrants, usually are older generations that are finding difficult to adjust to this new environment. There's a new language, and it's a totally different culture. Now, when it comes to structural barriers, these are the ones that World Wellness is actively advocating on for change, and is one of the main things that Culture Care is trying to work with clients and other organizations. There's underused existing care support services, and the structural barriers are because of lack of appropriate language support. Some GPs do see it useful or financially smart to have an interpreter over the phone or face-to-face. There is the mistrust due to past experience of discrimination and the lack of cultural appropriate services. I will talk a little bit more about this, but the mostly mainstream services are targeting clients in a very Anglo way. So some multicultural carers will seek more for support in-house than respite support, because that's how they are used to. They expect that as well. Care support services, including helplines, are not child-friendly and accessible. We've had many with the experience of trying to call support services, and they usually face the pre-recorded message in English, and that's as much as they will go. The community struggle with formal language and bureaucracy processes, and I'll say this is added on more, especially if you're not from multicultural backgrounds. Just raise your hand if you have finding very easy to navigate Centrelink and apply for parenting support. It's very difficult, the language. So imagine if you don't have the language. And as again, there's the cultural specific supports. They'd rather prefer in-home supports. We have seen that from our clients. Literature also is telling us this. And there is also within the retirement places, the food that they provide is not what they used to. So it's going to be difficult for them to say yes for respite. Informal caring is higher as well. Expectations is especially the collectivistic societies that multicultural clients come from, and trying to adapt to a more individualistic type of society that is Australia. And there is limited support to community and faith leaders on how to support their own community. I wanted to add this as well because it's part of our experience, and because culture care also provides supports to community and faith leaders. So now, what is culture care? So culture care is a program within World Wellness Group. Provides emotional and psychosocial support and links to services. Multicultural carers who are feeling overwhelmed or their own mental health has been impacted because of their role of caring for someone with mental health needs. So we don't need the person to have a diagnosis. The person they're caring for to have a diagnosis is just the carer who are providing support to someone is feeling, and that someone is feeling stress, depression symptoms or they're having a hard time, and hence is impacting them and their emotional well-being. So those are the ones. All right. We are a partnership program between with ARAFME, and we're funded by Queensland Health. We are statewide in Queensland. We're free. And the support we provide is individual or in groups, and is either face-to-face or over the phone. Because we're a small team, we prefer to be over the phone, and that's how the program has been built, as we have a phone number for people to call. As you can see, there's an image there of one of our support groups, and Ainor is in the background. She is one of our team, one of the team of culture care, and she's the one facilitating the support groups. So what we are offering, we're offering information and education sessions to carers and emotional and community members. We are advocating for awareness of multicultural carers in mental health and communities and the sector. So this is on top of providing the emotional support. And what's the eligibility? Who can access our services? Basically, anybody from the multicultural community who are supporting someone with mental health needs. Again, doesn't have to have a diagnosis. Visa status is not a barrier. So asylum seekers, bridging visas, international students, anybody can access. And we are extending our definition of carers as well to our community and faith leaders. At the end, they're actually carers of their own community. What we cannot support, unfortunately, is young carers under 18 years old. That is a different area that hopefully with more funding, we might be able to touch. Someone who is employed as a carer, so that receive money from their caring duties, students on placement, or cares for people who do not have poor mental health. So how to refer? It's very easy, I'll say. You can call. We are using the same phone number of the Multicultural Connect line. The clients who reach us through those numbers, they call. If they don't have the language, most of the time their first word is interpreter, and we understand what that means. Then it's follow which language do you prefer and which gender. And we can connect to an interpreter over the phone and have a chat with them. There's also the mental health referral form that you can download from our webpage, and there's the links in the slide. You can also be referred by calling the other phone number that we have, which is the Wide World Wellness Group phone number, but it's better to call the 1-300. And for accessing that number is Monday to Friday from 9 a.m. until 4:30 p.m. And we will call you back in the next business day. That's it from me. Thank you.
First question is from Lynn. Is the carer allowance still income and asset tested? I don't know who would like to take that question. Annabel, I think you're happy to take that.
So it's my understanding that the carer payment is income and asset tested. The payment is essentially, fortnightly, like salary type, a payment that you can receive from Services Australia. Well, it's paid for by the Department of Social Services, and that's for carers who cannot work due to their caring responsibility, and you can work part-time on that. But of course, there's an income test. So if you go over the income test, your carer payment is subsequently reduced, and you do get notice on that. The carer allowance, I think, has a much weaker threshold. There's the carer allowance and the carer supplement. So there are two payments paid on top of the carer payment that you don't have to be on the carer payment to get it. So they're paid to about 700,000 carers, 680,000 carers receive that, and it's to help with things like medicines and transport. So it's my understanding that the allowance is not asset tested in the way the carer payment is.
We have a question for Viviana. What sort of support do you give to community and faith leaders? Can you provide some examples?
At this stage, it is more about information sessions. So we've had already a leaders forum session, and it was about just what means to be a carer and the carer's journey. A lot of input came from that, and it was positive around they did not know about what a carer is as well. And understanding that journey was something very important, because they will know that the reason why is this community member coming to them so many times. And our next session will be understanding the navigation of mental health here in Australia. As we see, one of the gaps they have is how to direct their members to services as well.
Thank you, Viviana. I just want to follow up on the question because it's sort of linked to it. I will address it to both of you, but it was mentioned in the presentations that often people from culturally linguistically diverse backgrounds, they don't necessarily identify as a carer. Why is it the case, and how you sort of explain it to them? Because if they're not seen, that will obviously change the statistics and the impact. Do you want to go first, Viviana, with that?
Yeah, sure. Usually what I go is, if it is a mom, I ask them, so you're caring for your son. That means that you're providing a lot of support to him in the home. In Australia, we call that carers. Have you heard about that term? And then it's unpacking that.
Thank you. Annabel, would you like to add anything to that?
Sure, but I'm really pleased to see Viviana and I seem to have some correlating data, so we feel it's very true. But yeah, we tend to find a useful way to talk to carers can be talking about the tasks of caring, like you helping someone in your family, for example, with the tasks of daily living, like, are you helping shower them and clean them? So when we talk about, or do you do their cooking for them, or do you help them pay their bills? When we start to talk about caring tasks, help them with medication, people can then identify with the role rather than the terminology. which seems to be useful. Yes, I do those things, but no, I'm not a carer, would be a sort of a response we get quite often.
Thanks, Annabel. Now, there was mentioned in one of the presentations, I think it was actually in both, but that there was an issue with social isolation for carers.
We do a lot of the time is connecting them to community, going back to community. Is asking about who do you enjoy doing the most? What do you enjoy the most? Is it about going out in a park, talking to someone and drinking some chai, or is it about just exploring with them what is it back home that used to bring them joy, and try to connect them that to those supports here. So we try as well to, a lot of community or neighborhood centers will have some social groups, and some of them, they're now getting more populated with people from different backgrounds, and it's about advocating about that client, and if there's someone in that group that has same or similar backgrounds, if they can be put together or introduce themselves, and that kickstarts a support there for them, and try to break that social isolation.
I'd agree that, finding those networks and activities carers enjoy are really important. And I think there's probably another aspect too, which is enabling the carer to take time out to do that. So carers, I think that's why I, talk a lot about respite or some kind of support, because if a carer's on 24/7, and sometimes we're talking about really difficult things, like a parent sitting outside their child's room at night because they're on suicide watch. We're talking about difficult stuff. There isn't time in the day to then, maybe do those things they want to do for themselves to help with that connectivity. So the respite enables the carer to take a moment out and go and talk to another person. I think the other aspect we really want to encourage is some social change. So it's the community around the carer reaching out, can I help you with something? And that's that enabling thing. We spoke to a carer the other day, and it was a lovely story. She has a good friend, and the good friend, when they go to the shops, just say, do you need something? Because this carer had a profoundly disabled child, so she couldn't just get out of the house to grab milk in 15 minutes. It was quite it's quite an exercise to get a child into the car and make sure the supports are there, wheelchair and everything. So having a friend just being able to go to the shops, and then they just manage the money with, their banking app, that saves her probably an hour and a half, and takes her friend 3 minutes to do, and drops in and says hi. Simple things like that can make a big difference and help reduce that sense of isolation. So it's also about community helping. And I think that work you're doing, Viviana, with leaders in the community sounds like a powerful way to enable that change.
There was in your presentation, Viviana, you mentioned that informal caring is higher in the multicultural community. Is there a reason why that's higher in the multicultural community?
There is a few factors. I'll say the biggest one will be not identifying as a carer. So those carers will do as they know they should do based on their culture, and it's about tapping into family, supporting, cooking, cleaning, and there will be no recognition of that. And if there is, then it is seen that for them it is perceived that they're considered as a burden. The people they care for are considered as a burden. So they try to deter from that as well, and just try to do everything for themselves, for the carer.
Yeah, that's my understanding. I think cultural expectation plays into it too. So that example I gave, it's seen as a negative if you seek external support services. And if somebody needs, say, 30 hours care a week, then the informal unpaid friend or family member carer will be taking it on board, where it might be seen as a failing to seek outside support for a host of reasons, including those Viviana described.
We've had a few stories of people being discriminated before, and hence they don't want the carer to reach out for support for fear of being discriminated again.
Now, there is another question we have in the chat, which is a very current question. Should you have a call from someone who speaks a language that is rare, what will happen to their needs if you don't have an interpreter? And is the interpreter a live person or a AI, if it's a rare language?
We've so far, what we do usually is that we, if it's not accessible right there and there over the phone, then we booked one through the interpreting services we have. Usually they have the language, is just they are not easy to reach because it's rare, or they have just a few. Otherwise, we have a program called the MPSWs, or Multicultural Peer Support Workers. And within that program, we recruit people who are able to provide a language and the cultural background. So if there is none, we try to reach through community who is keen to be able of the team. If not, then we'll be reaching community leaders to see what we can do to reach that client, or any other language that they speak. Sometimes they speak another language, so we try to also to reach through that.
And I want to ask you sort of more policy questions, that's okay. So, because you are CEO of Carers Australia, and there's a lot happening, aged care system reforms, new Aged Care Act, Carers Gateway. How do you see the future in terms of your advocacy, talking to government leaders to ensure that the service system is inclusive generally for people with a disability, for people from multicultural backgrounds, that they can access the carer support, the support they need as carers with diverse needs? And
I think we're getting a little bit better at this. What we can see with NDIS reform, for example, is a lot of lived experience consultation, and that means going out and speaking to people using the services with an acknowledgement of the intersectionality of that audience. So, we're talking about culturally and linguistically diverse carers, for example, but there are, a large proportion of carers live with disability, and, might be LGBTIQA+, or, people can come from lots of different communities, and it won't be just one. So I think what the government is doing is showing early signs of a commitment to at least consulting with those carers to see what they need. So we certainly know that NDIS is starting to get better at consulting with carers, not just the end users of the disability insurance scheme, which is really great. In the National Carer Strategy, you can see in the action plan that there's actually around Carer Gateway Services actions 1.7 and 1.8 are framed around enabling Carer Gateway services so they're better, they're more accessible, particular for specific cohorts like called carers. So, we'll, as an organisation, be watching government to make sure that's being implemented, but we can see the intent there. I think in aged care, it's rather complex as they move to the home care packages system. So we're in a period of transition, and there are some challenging constraints in provision of aged care. So I think we can get much better at acknowledging carers in that setting. I think there's a lot more work to go. But in the NDIS and the carer space, there's obviously the carer space is a good acknowledgement of carers. NDIS, it's getting better and emerging and developing. And I think in aged care, we've got some work to do. The reforms referred to carers, but not nearly often enough. They're not acknowledged as a partner in care.
Thank you very much for that beautiful comment, and your advocacy as well that you're doing all the time, and very hard work, obviously, with all the reforms happening in different sectors. Thank you very much. It's all we have for the Q&A.